Hey, it's Dr. Gonzalez. This is one of the questions that I get the very most in regards to back injuries, especially disc injuries, and it is about ripping off the scab. And I've told patients often about don't rip off the scab, don't go into flexion, don't do this, don't do that, but you can do these. I give them a whole parameter of things they can do, and really it revolves around they're going to succeed very well if they understand how not to rip off the scab and why. So I've gone over some other videos on why not to rip the scab off. So this time I'm going to draw. We're going to do some illustrations on what's happening at the level of the spine. So bear with me here while I get this GoPro going. So here's what happens. All right, so this is what we draw all the time. So first off, everyone has to understand first that there is a disc. Let's see how well I can draw while looking at a screen. So we have a disc here, has all these little what we call annular fibers, and in the center is this jelly donut. I know a lot of people have heard of this called as the jelly donut, and the disc herniation really is dependent upon how far this jelly can extrude out of this disc. Okay? Imagine that is a herniation. Also, we have like little annular fissures and so on. There's little breaks in here that can happen. So, understand this. The disc is a jelly donut, and if you put pressure on this side, say we put a force down on it, it'll squish everything back in. If we put a force on this side, it pushes everything this way. And this is why this is important in regards to flexion. Flexion will create this type of force. Extension, or some McKinsey's exercises, or things that make you feel better, oftentimes create this type of force, pushing the stuff back in. So here's what is the important part in regards to not ripping off the scab. We have to realize that when this happens, there's also chemicals that come out. Okay? The chemicals are, I guess, what everyone would call inflammation. There's also muscles surrounding it. Here's a reflection of muscle fibers. Now, muscle fibers are usually intended to, they protect the area. And these are mainly called the multifidus, the rotatories, and so on. Let's see if I can get a there we go, it's a little bit better with the shadow. So usually they protect this area. And if they're not protecting the area, this whole area just gets shredded up over and over and over again. So what happens when you have all these chemicals, they actually affect the muscle and create fatty deposits and latency of contraction. I'll write that down. Latency of contraction, meaning that they just fire away too late. Again, the purpose of these muscles is to stabilize the area prior to movement to protect these and put your body into a proper position so it doesn't shred itself up. Now, if these things are latent or late, then these don't do their job, and this thing gets torn up, creating more chemicals, creating the fatty infiltrate, creating more latency, and creating more pain. So here's typically how we rehab people. Okay, first we have to understand that, again, that the flexion or extension are the first part. Figure out which one the person is more tolerant to. Okay, if we figure out the person really doesn't like flexion because they have a disc injury, then we have to limit the amount of flexion they do. What happens when we limit flexion? Well, we're going to stop this, which stops this, which stops this, which stops this, which stops the latency and stops the further injury. So I call, let's see, ripping the scab. I always tell people, don't rip the scab off. Just stop ripping the scab off. And they're like, well, I'm not doing anything I used to do. I get it, but we have to figure out the things that you are doing which is still providing this load. So I hope this is understandable to everybody, because we have to stop this first. In order to stop this, in order to give the muscles a chance to get rehab and to get stronger. and to decrease their latency in order to protect the disc. Okay, so a disc injury, it's not the end of everything. It's actually very, very productive in regards to having it, because now you understand how things work. Because things like this are very, very easy when they make sense, or they make a lot of sense to people when they really understand what's going on. But the uncertainty and the not knowing and the loss of control is what people typically have with this condition, because almost everything you do hurts. Moving and getting out of a car hurts. Putting on shoes bothers you. Rolling out of bed. I mean, there's so many things that bother patients and athletes that have this, that sometimes just a sense of control and knowing what hurts and what doesn't and what movements hurt and so on is just the start. And this will carry on into your other sports injuries. So again, back injuries, disc injuries in this case are not a death sentence. I actually have one. I know a lot of people that have them that actually are very, very athletic and lift a lot of weights and do almost whatever they want to. And I do pretty much whatever I want to in regards to athletics. So, hope this was helpful. Contact me if you have questions. Comments on the bottom. I do podcasts on secondary level questions beyond stuff like this, like ask me what chemicals they are. Actually, please don't, because I don't want to go too much into that. But you can ask what muscles are included in the stabilizer groups. There's so many things you can ask if you want to understand more. So please ask. Be featured in the podcast. That's Performance Plays Sports Care Podcast. And go on to p2sportscare.com. That's where we have the area where you can leave a voicemail to be featured on the podcast.